Hi, my name is Joanne Abrassart, and I recently became a patient of Dr. Hosalkar after a 3-month search and 6 medical consults for what I thought was a problem with my lower spine. I had been to a couple of chiropractors who helped to address some of my issues, but none of it was lasting. And I finally decided that I probably needed to consult with my local orthopedist and see if he could send me for an MRI of my spine. I did that, and he was more than willing to send me for the MRI, but in the process of being in his office, he checked out the range of motion for both of my legs and found that my right leg was significantly uh, less mobile than the left. So he ordered a couple of x-rays and walked into the room with them a few minutes later and said, "You have bone on bone in your right hip and you need a hip replacement." Not exactly what I wanted to hear. So I took this information to my wellness doctor that I see down in La Jolla, and he said, well, before you go into surgery, why don't you at least consider the possibility of a stem cell treatment and see what this might do for you? So he referred me to an orthopedic surgeon in San Diego who does the standard um, surgical procedures, but also has stem cells as an alternative procedure. And I sent my x-ray to him, and his opinion was that I did have, in fact, a need for a hip replacement. And I was beginning to hear this now often enough that I thought, well, maybe I really do have this problem, and maybe I should just face it and begin to deal with it. So he ordered another x-ray, and as I'm laying there on the table and the tech is starting to take the x-ray, he makes some comment about, we have to measure you for your prosthesis. My what? Just another thing I didn't want to hear. And what that showed me was that how really resistant my attitude was about having a hip replacement, despite my willingness to discuss the topic. When the results of that x-ray were shown to the medical staff there in San Diego, it was very different from the one that I had had done here in town. This one showed no bone on bone. There was a nice space around the edge of the ball as it fit into the socket. And what it did show was that I had significant impingement with bone spurs and most likely some tearing of the cartilage up in the socket. So some discussion proceeded to take place about the possibility of doing an arthroscopic procedure to remove the impingement and then to follow that up with a stem cell treatment to address the cartilage tears. It had become rather apparent to them that I was not terribly receptive to the recommendation of a hip replacement. So off I went to this consult with another orthopedic surgeon who does this arthroscopic procedure, and he reviewed the films that I brought with me. He took his own films and he referred me out for a contrast MRI. But his opinion remained the same as theirs, that I in fact needed a hip replacement. He was afraid that the arthroscopic procedure would only address some of the impingement but not be able to get to all of it, so I really wouldn't have my problems resolved. So why not just go straight to a hip replacement? So at this point, after talking to all these people, I really wasn't, I really didn't know what to do. I did know that I had impingement. I knew that stem cells alone would not address that, so they had to be removed somehow. I knew that if they just remained, that they would probably just get worse and I would continue to have pain in my hip. But I really didn't have a sense of where to go with this. Now, in the meantime, the doctor in San Diego had asked if I would mind if he could forward my information to a friend of his who at the time was out of town. And he explained something about a procedure that this guy did that, might be helpful to me, but I didn't get it at the time. I just said, well, if you want somebody else to look at it, it's fine with me. Go ahead. So 2 to 3 weeks went by where I didn't know what to do, and so I did nothing. And as I was walking out of the lab where I had the contrast MRI done, I got a phone call, and I didn't recognize the number. Well, it was Dr. Hosalkar calling to say that he had reviewed my paperwork, had a pretty good understanding of what my issues were, and that he had a procedure that he thought I would be a very good candidate for if I was willing to come in and have a consult. Let's talk this over. So I thought, well, with all these consults, why don't we just do another one? So I met with him. I was somewhat intrigued by some of the things that he had said, and I said, okay, well, just tell me more. So in his consult, he had a computerized presentation of the surgical procedure. He also showed me some pictures of other people's surgeries to make it more realistic and show me what he would suggest that we do. He had me look at my MRIs, my X-rays, and we went back and forth talking about what he found in terms of my results and how he would address that surgically without a prosthesis. I would get to keep all my own parts. He would just remove all the impingement, repair the cartilage damage, and then put everything back the way it's supposed to be. Well, I was quite intrigued by this, and he spent a good, 45 minutes or an hour discussing all of these things with me. And at the end, he just looked at me and he said, well, you probably want to go home and think this over. And I thought, no. And I told him, no, I don't want to go home and think this over. In fact, I made my decision about 10 minutes ago while you were still talking. So I went out to his front office and spoke with his surgery scheduler. And by the time I left his office, I had a surgery date. I was convinced that the answer to my problem had finally presented itself after this long process of pursuing information and answers. So I basically went home and got ready for surgery. Right now, I'm a little over 3 months post-surgery. I am doing very, very well. I have virtually no pain. The little bit of pain I have, I wouldn't even call it pain. It's more stiffness that still has to work itself out. That's just a byproduct of surgery. My range of motion on my right side is almost equal to that of my left. I expect that that will improve as time goes by as well, and I continue to work out. The recovery process for this kind of procedure is a little bit different from a total hip replacement, because with that one they have you upstanding quite soon and they want you to put weight on your new hip. With hip preservation, you have to stay away from complete weight bearing initially and then build up to more and more of that. And there is about a 4-week time of just flat out healing. You have a few basic exercises to do, but you're not supposed to go directly into physical therapy immediately. I figured, or at least my attitude was, that the length of recovery and the type of recovery was a trade-off worth having in order to keep all my own parts. Um, Also, part of the issue I had was that I'm in my early 60s, and I was practically guaranteed a second hip replacement if I lived into my 80s, which so many people are doing now and beyond. And you can imagine, I wasn't thrilled with the thought of one, so having a second one really didn't appeal to me at all, really, not at all. So anyway, I'm very happy with the decision that I made. My physical therapist started working with me after week 4. She had me doing quite a wide range of exercises to strengthen, to stretch, to increase mobility and weight bearing. Then we transferred those same things to the pool, where I was able to do more without with better buoyancy in the water. You can do more things and not stress your joints as much. And then the stationary bike. Now I'm basically walking without assistance and just getting on with my life. More healing will continue, but that's fine, because for right now I'm back to my regular activities and back to my life. I really am very grateful that I've had an option like this. I'm very grateful that Dr. Hosalkar pursued this with me and gave me the opportunity to think about this kind of thing and even consider it for myself. This is not a typical thing that an orthopedic surgeon does. But then again, Dr. Hosalkar isn't your typical surgeon. It seems very apparent to me that this is not just a job that he shows up for. He has a passion for the job, for the task, the surgical task, but more than that, he has a real passion for his patients. He seems very invested in them. It's important to him that his patients do well, that they succeed, that they come out of this surgery, do well, and move on to live a productive life. In the past, this has not been your typical profile for a surgeon. Oftentimes, surgeons have been seen as people that you can't even have a conversation with, let alone engage with in a cordial manner. Because of this, I consider Dr. Hosalkar to be an uncommon physician in general and an uncommon surgeon in particular. And I am very happy that he even considered me to be a candidate. If you are even remotely hesitant about having a hip replacement surgery, as I was, I would think it would be very worth your time, energy, money, whatever, to at least call him, sit down, have a consult, and see if this procedure of hip preservation might be for you. Whatever you decide to do, I hope it works out well for you. Thanks.